just let you know about, first of all, is who we are, where we've come from. Joe and I have both been in chiropractic for quite a while now. Joe initially started as a chiropractic assistant, which means she was helping out on the front desk, assisting the chiropractors in the rooms as well, looking after patients and making sure that they're well cared for from the moment they walk in to the moment they leave the door. From my point of view, I came into chiropractic 14 years ago, and I finished up after doing a degree in physiology at Newcastle and a master's in chiropractic at Surrey. Started off in my career in 2001, and then a few years later took over a first business, which is Radcliffe Chiropractic Centre, and that was a centre which grew over the time that I was there. Joe came on board and we changed things around, brought people in, had a bit of a network of different professionals. We had massage and chiropractic on site, we had reflexologists, baby massage therapists, Pilates instructors and other professionals off-site who we referred on to and had a referral network with, which is what we're looking to build here. Okay, so this is where we're going to, which is the studio, and we're having it built out of the front of, the back, sorry, of the building here, and we're going to be looking at having a very bespoke service, particularly for certain people like mums to be, their children, and mums who have got back into work, had a bit of a struggle in terms of getting the life balance right, getting a lot of stress and the effects of that stress, of course, which can be anything from headaches and back pain through to IBS and that kind of thing. Okay, we can aim to help them improve that from the root cause by helping them with their lifestyle as much as we can with the symptoms they come in with. So what do? Well, chiropractic, massage. One big part of the chiropractic side of things is actually adjustments, and we adjust babies and children as well as adults. I'm trained to do that. And of course, like I said, the population we're looking at really is ladies who are looking at having a family, pregnant, getting some symptoms then, when they've had the children, and their lifestyle and that side of things. Okay, so what we're going to look at today is mainly working on some of the things that we would check first of all, so that you get an idea as to what would happen if you were not sure about a child, that maybe they had a traumatic birth, maybe they'd had some issues like refluxy type symptoms, colicky type symptoms, which we'll talk about later. Okay. Now the things that we would check, we would always be asking a lot of things in the history, like sleep, feeding patterns, history of the birth, history of the pregnancy. We would check their vital signs as well, so we'd check their length, weight, head circumference, we check the fontanelles, the little hollows at the top of the skull, temperature, respiratory rate, blood pressure. Also looking very carefully, and this is really important and something that you can help with as well, which is looking on the skin, looking for any kind of little marks that look slightly brown, colorations, slightly red, called port wine coloration, so that kind of dark red colour. Anything where it looks like there's no pigment in the skin at all, where it looks like little white bleach spots. Okay, really, really important to look for them, check for them, and refer on for absolute certain, not to ourselves, but actually to a paediatrician, because they're important things to look for. Things that we would check as well, we'd check posture, tone of muscles, we'll check cranial nerves, which are the nerves mainly which go to the senses, so sight, hearing, sense of smell, and ability to make sounds, okay, which of course will vary according to the age of the child. Also, there's some things called automisms, which are basic primitive reflexes, which we have to look for in especially premature babies, but all the way through, to see when this is happening. As you can see from the table, there's quite a few different ones that we check. There's 6 different ones that we check, and if you want me to go through them later, I can go through them later with you and show you for sure. Okay. Unfortunately, Oakley, our youngest, is in bed, so we're not going to be able to actually get him up and do some of the checks on him. Mind you, he is over a year old. So, all right. Now, in terms of how you can advise parents straight away, I would say 3 most important things. Skin to skin, so important right from the very second that they're born, and getting baby onto skin to skin contact is so important, but going forward from that as well, really important in those early few weeks and months. Tummy time, massively important, even at an early age when they can't move much, getting them onto their tummy and they go up into that little crunched up position, and then later on they start to stretch out, start to lift their head up. It builds that postural tone, which is so important. Okay. Of course, the other thing is face time, because babies learn a huge amount from what they see, what they pick up from parents, and getting the face time, seeing the expressions, listening to the words, seeing the shape of the mouth, all of that sort of thing is so important. It helps with eyes, with focus, and has in the past been thought to be a very important area to look at when we're considering where autism and children on the autistic spectrum, where some of the causes come from with that. Because if some of the causes are to do with an inability to socially interact, maybe this FaceTime side of things could be important. Okay, a few references at the bottom of the page there, and I'd encourage you to take them up, have a look at them. When we look at pregnant ladies, we're going to look mainly at late pregnancy, mainly because it's the birth position which is so important. It's getting mum into the right physical shape, as it were, up to that point through core work, through adjustments. If they're seeing chiropractors like myself, we'd always do that. But making sure that when they actually come to the point of having of labour and giving birth, that baby's in as good a shape as possible. Really good technique, which I'm shortly going to be learning. It's called the Webster technique. I'm going to be learning it actually weekend after next. It's all about turning baby, getting baby into the right position for birth, so that there's less chance of complications, hopefully less pain during labour and that side of things. When a baby's born, of course, sometimes you see that head's a little bit misshapen, particularly if there's been a vacuum or ventouse used, or sometimes forceps. That should actually return to normal within a few hours. Now, if that's not happening, we need to check, and we need to make sure that we can do some cranial work quickly to help any stress and strain that's happened to the soft bones of the skull, help that to get back to normal. Okay, because if that skull isn't in the right position, then there's going to be malposition of the head on the spine. There's going to be torsion of the tough membrane that surrounds the brain and spinal cord, called the dura. Okay, and that can have big effects. It's the main root cause of a lot of problems from the point of view of the technique that I do, which is called sacro-occipital technique. So what we would do is we'd always look at any visual stuff that's going on. We'd measure the amount of asymmetry, okay, and we'd also check further down, check the neck, check the shoulders as well, because of course sometimes birth trauma can be to the extent where there's a broken collarbone or something, and that's going to require evaluation and medical notes. What can also happen is at the other end of the body, it can end up with something called talipes, which more commonly called clubfoot. It's more common in multiple pregnancies, so twins, triplets, but that has to be addressed really early. It doesn't always have to mean that baby's going to be in faster for X number of months. Can be helped through chiropractic work, physiotherapy as well, working together with that. Okay, so from
from the point of view of mum, what can mum do? Well, you've got to look at any pelvic and postural issues very, very early on in pregnancy, as early as possible, preferably pre-pregnancy. Get things right before they start any of this. Okay. Massage, of course, very, very good. Really good one. I don't know if you guys have done this, but babies have had a cesarean section, just being massaged straight through from the vertex down over the ears into the jaw and the neck, just working down, okay, stimulating some primitive reflexes through sensation, getting things to settle down as quickly as possible, so they can develop really, really well. Okay, so now a couple of things we're going to talk about now. Colic. Now, I'm not going to talk specifically about colic because I don't really believe that colic is anything other than a good symptom, which we could quite easily call ill to the baby, or the baby is not sleeping well and crying a lot. Colic is just a bit of a throwaway term as far as I'm concerned, and really what we've got to look at is the things underlying it. Okay? So, like I say, colic's a bunch of symptoms, it's not a diagnosis. There can be lots of other issues, more serious issues that we can't afford to ignore. So we need to check, again, visually, check the lashes, spots, need to check to see if babies actually getting dirty nappies, if there's any bloating, wind, constipation, diarrhea, and make sure that those symptoms are getting worse, make sure there's any vomiting, of course, breathing, make sure that's nice and regular, make sure there's any kind of fever going on, make sure that they're actually taking in fluid and that they're getting wet nappies at the other end, and make sure the baby's actually holding themselves properly, they're not in this kind of position. Because anything like that can be potentially serious sign, needs immediate referral, certainly to the GP, but I would probably say we're talking phone up GP and say what's going on, and they'd advise about going to A&E potentially. Okay. Now, a few things that we've found to be effective in our practice. Adjusting the upper neck using this little gadget here, which is called an activator. Okay, I'll show you here. We set it really, really low. We put our finger over it. That a little quick there. Okay, just a little bit of movement, tiny amount of input. It's high velocity, very, very low amplitude. Really, really soft adjustment. Okay, but very quick. Something called Colic Calm, which you might have come across before. I put the link to it on here. Really, really useful. It's a charcoal suspension. It's called a homeopathic remedy. It's not really. It's a charcoal suspension. Very, very useful if it seems to be more of a gastric type of thing. Contingent music, which is a technique to get baby to settle, where you play the music when they're calm and attentive, so not asleep but calm and attentive, and then if they start to unsettle, start to cry again, switch the music off, tend to their knees, check nappy, see if they need feeding, all of that sort of thing, and then when they calm down again, music's back on. Another thing that's important, if mum's breastfeeding, dairy-free diet can be a really, really commonly overlooked cause. And the other area that we're looking at today is reflux. Okay. Now, of course, some positing, some spit ups are quite normal. It can carry on for quite a number of months, even into the second year. But the main thing with babies is that you're always going to see it. There's no such thing in babies as silent reflux. It's always going to come out. Okay. So if they're getting upset and sort of coughing and spluttering a bit, it's not going to be a reflux problem unless you've seen the reflux. Sometimes the reflux can be pretty dramatic, can be firing off. I remember a mum that came in with a baby and she was measuring the improvement with the distance that the reflux was going, and when it started to shorten down we knew that things were improving. Hopefully we don't get anything like that again for a few more years. But an important thing is that actually you can start to get coughing, wheezing, and even to the point of getting lung infections, respiratory infections, because the reflux can sometimes go back down the wrong way and it can upset breathing, that side of things. Okay.
can start in the first 1 to 2 weeks, and like I said, it can carry on for quite a long time. We have found, and colleagues as well, that there's a number of different things you can do. Again, checking baby, baby massage, of course. I'm sure you found that that's really, really effective. Okay, just to settle baby down, to help with that digestive side of things. Okay, my belief is that it could be down to some kind of slow development of digestion, which means that although the baby's showing every single sign that they're getting on well with food, actually their digestive system is just a little bit slow to take up. Okay, decreased dairy diet can be important with that. Giving it a little bit of time to settle down, of course, is very important. Carrying baby upright, so not always down and not just upright straight off the feed, but carrying them upright a little bit more once they're during their spine can take it. Okay. Also, just tilting the cot or the crib up a tiny bit, but we're only talking millimetres, we're not talking a great big ramp, just talking a little bit, okay? Just so that there's just a slight gravitational pull, because, again, baby's digestive system might not be moving the food away and down quite so well. And if we get anything coming back up, it's going to irritate, they're going to cough, splutter, out it comes, okay? So, Joe, if you'd like to turn that off.